You spend years carrying heavy backpacks, running miles under load, rucking, pushing through pain because the mission always came first. Now, every time you get out of a chair, your back reminds you of all those years in service. Now, here's the truth. Most of what you've been told about back pain is dead wrong, and it's keeping you stuck in pain. In this video, I'm going to bust 9 of the biggest myths about back pain that stops veterans like you from running, lifting, rucking, and living pain-free again. I'm Dr. Ray Peralta, physical therapist and Marine vet. For almost 10 years, I've helped hundreds of veterans and everyday athletes beat pain, get back to running, lifting, and rucking and doing the sports they love. By the end of this video, you'll know the truth about back pain. When you understand what's really going on, you can take control, start recovering instead of feeling stuck or broken. So I'm going to walk you through 9 myths that keep veterans stuck in pain and give you the facts you need to get back to full strength. So, myth number 1, back pain means something is seriously wrong. I hear, if my back hurts, I must have serious injury. See, the thing is, most veterans, for most of them, back pain is actually mechanical or movement related. See, it's not caused by a catastrophic injury or disease, right? It's not like from like a car accident or something. Sure, those things do happen, and they're extremely rare, though. Maybe like 2% of the time do I see people who actually come because of actual trauma or disease or something like that, like a spinal infection. Most of this back pain is actually due to a series of, micro incidents, right? Little incidents, right? Years of rucking, hard landings, long hours sitting in vehicles. That could throw your spine out of bounds, right? Maybe you're jumping out of airplanes, right? And now you're working a desk job, you're sitting 8 hours a day, and those 8 hours a day that you're sitting actually causes overstretching of ligaments, and that can actually be the cause of your back pain. Actually, sitting could be, as often more times than not, what I see the cause of the back pain. See, this causes the pain that will come and go. You'll have good days and bad days. You probably notice that, hey, you get out of your chair, you start moving around, and you feel better. You feel better on the weekends when you're not at your 9 to 5 desk job. See, the right movement can reverse the problem without surgery or lifelong meds. See, one of my clients, retired Army Ranger, thought he had blown out a disc, right? But we did 3 weeks of simple movement drills, no meds, no injections, and he was back rucking under the barbell, doing squats, pain-free, right? Because we did the right type of exercises, the right type of PT, because not all PT is the same, but we did a specialized PT for his back pain to help him move again, restore his mobility, and he was feeling confident again, and rapid reversal in pain in just 3 weeks. So this can happen. Sure, results may vary, but it is possible to avoid, meds and injections with just movement alone. Myth number 2, the more pain you feel, the more damage you have. Another thing I hear is, it hurts so bad. My back must be falling apart. See, fact, pain doesn't always equal tissue damage. Your nervous system can stay on high alert long after tissues heal. See, the thing is, most tissues heal within 3 to 6 months. So chronic pain more than 6 months, is more to do with sensitivity of the nervous system than it is actual tissue damage. See, stress, poor sleep. I'm looking at you folks who sleep under 6 hours a night and think, you're like Jocko, like, oh, I could operate on under 6 hours. Very few people do. Sure, if you have the genetic, you're the outlier, cool, but most people aren't like that. And even memories of old injuries can turn the pain volume way up. See, a flare-up doesn't mean you're breaking down. It means your system is sensitive and not damaged, right? And when I mean the system, the nervous system, right? So the nervous system can be on high alert, right? And it'll continue to be ramped up, and you are going to be tied to thoughts, emotions, and even mental health things like PTSD, depression, anxiety can ramp up the nervous system and cause the pain to persist. Myth number 3, you need an MRI or an X-ray to find the problem. See, I hear this all the time. Doc, I need a scan to see what's wrong with my spine. How you going to help me? You don't got the MRI, man. You don't got the X-ray, bro. See, scans often create fear, not solutions. See, 40% of pain-free adults show a bulging disc on MRI. Half of all 40-year-olds have degeneration with zero pain. Interestingly enough, though, there's people with severe back pain. They'll go to the doctor, get an X-ray, MRI. Scan looks normal, yet they're in severe back pain. The doctor can't explain, like, hey, your imaging looks normal, yet you still have the severe back pain. See, scans are typically useful to rule out serious issues, right? Things like spinal infection, quad equina syndrome, cord compression syndrome, tumor in the spine, right, if you have a history of cancer. But not to diagnose the common everyday back pain that you just get from sitting too long or being in the vehicle, driving a couple hours, and now your back hurts because you've been sitting too long, right? That type of back pain isn't always diagnosed on imaging. Now, you can use imaging with examination findings, but imaging alone is not typically needed for the everyday back pain. And a lot of times, the everyday back pain can be properly assessed with a proper movement examination to determine, okay, is this back pain radiating down the leg? How's it presenting? with certain movement testing, something that I do as a physical therapist, training the McKenzie method. It is totally possible to do so without having to rely on an X-ray MRI. Again, unless you had obvious trauma, like you were in a car accident or you fell down a set of flight of stairs and you landed on your back, and now you're in severe pain. Obviously, go to the emergency room, get that checked out. But if you didn't have an obvious trauma, right, or anything like that, oftentimes most of the back pain that you get just from sitting all day, or just you woke up one morning and now your back hurts, doesn't typically need advanced imaging. You could just work with a physical therapist, ideally one trained in the McKenzie method. And I also ideally one who also knows how to work with veterans, especially high performers who want to get back to running or lifting, things like that. Myth number 4, rest is the best cure. Thing also here, I should take it easy until the pain disappears. You don't get it, Ray. I got to get bed rest. I can't be moving around. I got to lay in bed. I got to protect myself. See, rest actually slows recovery, right? You might be scratching your head. Didn't you say sleep is important? Sleep is important, but you shouldn't be spending your waking hours in bed. It's called bed rest, right? There's sleep, but then there's also just laying in bed all day when you should have been up and around, moving around, right? You can have bed rest for the first 2 or 3 days, right? But afterwards, you're going to have to start moving around. Otherwise, if you're in bed all week without any movement, you just keep yourself bed bound for 7 days, that's going to lead to stiffness, weakness, and it happens pretty rapidly. Right after the 3rd day, the 4th, 5th day, etc., your back starts getting really weak. The muscles around your back get very weak. So unless you had some major trauma or some major surgery, most people should be up and about after the 3rd day tops. Even if it's just gentle movement or gentle gray movement, like just 2 minutes of walking here and there every few hours, right? Even if you're in severe pain, you can move 2 minutes, right? You could suck it up just for 2 minutes, a walk around, light walking or specific drills, right? For drills, I mean, gentle back stretches. Maybe it's a little bit of lumbar extension. Maybe it's a little bit of lumbar flexion. Maybe it's a little bit of both, right? Maybe do a little pelvic tilts, a little cat camel in your chair, or if you could tolerate it on hands and knees, like in yoga, a little cat camel. And you don't even have to, you just gently push into the pain back and forth. Maybe you start with 3 reps, then you go to 5 and 10 and so on. We start reintroducing gentle graded movement. Graded means you start progressively adding more reps, every week or so as you start improving. This is going to help speed up the healing and restore confidence in your body and your back ability to move. Otherwise, if you just trying to protect it and baby it, it's going to slow down the healing process. You're going to have a worse recovery. So motion is lotion. And this holds true even for the spine, for the back. Myth number 5, you should stop running, lifting, or sports forever. Actually, that's not the best advice, right? I hear people come into when I work with them, former patients, when they first started off, they're very fearful. And I understand back pain could be, I've had it myself, but they'll say, my back will never handle that again. I used to believe that too when I had, persistent chronic back pain. I'm not going to be able to lift 100 pounds. Are you kidding me? That's way too much. That's dangerous. Deadlifting 225 pounds. Whoa, dude. That's going to wreck the back. See, the thing is, avoiding activity is the fastest way to get weaker and stay in pain. See, you can get back to rucking, running, and lifting with the right plan and progression. See, a lot of times people are afraid of movement. It gets so bad. I've seen people who are afraid just to bend over and tie their shoes, right? Oh no, I'm going to throw out my back if I bend. And yes, bending for a lot of people with back pain can cause pain, but you just shouldn't be so fearful that you avoid it altogether. See, permanent avoidance leads to stiffness, fear, and chronic pain. So if you want to break the pain cycle, start reintroducing some of the movements you're afraid of. You don't have to go to a 225-pound deadlift, but maybe start doing some gentle cat camel, and then from cat camel, maybe start doing some forward bends or child pose, start reintroducing some flexion, and then over time, you maybe start lifting a 5-pound weight, then a 10-pound, and so forth. Maybe go to the 45-pound Olympic bar, and then you start working back in and start adding deadlifts back in, right? You shouldn't be afraid of lifting things up from the ground. So it's a normal human movement. You just have to retrain it, and it's possible to get done. Sure, it may take you 3 months, it may take you 6 months, but it is possible to restore movement in your back, even though you feel that your back pain is severe now. It can heal, and in most cases it does. Again, unless you had a traumatic or severe injury, back pain can heal. Obviously, you need to introduce the right movement. You just can't rest alone. And then, you can even go back to competing in martial arts. I like to train Brazilian Jiu-Jitsu. I had chronic back pain. For the longest time, I thought, I couldn't train martial arts or Jiu-Jitsu. But once my back was healed, I discovered, hey, I could heal my back with movement. I was able to go back to Jiu-Jitsu, heavy lifting, rucking, lifting. It's all possible. Myth number 6, a strong core will prevent or fix back pain. See, I hear this all the time. If I just get my abs strong enough, my pain will go away. I just got to get strong abs. See, the thing is, strength matters, but so does relaxation, mobility, coordination. See, many vets with back pain will think that they have to brace, right? They think they have to buy a back brace or just physically brace, like, tensing up. They try to tense up their back, their core 24/7, all right? This is going to increase tension and pain, right? Or even if you put the back brace on, if you wear the back brace, you wear that all day. Sure, you could wear it short term for maybe a couple hours here and there, but you shouldn't be wearing it all day. Because what's going to happen? It's going to shut off your muscles, and then when you take it off, your muscles are going to be dependent on the back brace. You're going to be a lot weaker. So the goal isn't just strength; it's knowing when to breathe, relax, and move naturally. And then you also don't want to be holding tension too long. If you're holding tension too long, you're not going to be able to move, right? You're going to have to be able to learn how to relax, to bend and extend your spine. And that's why mobility first, a lot of back pain, you have to restore mobility first, movement, then you can start reintroducing strength. And sure, there's some overlap depending on your stage of recovery where you do mobility and strength at the same time. But for many people, they start restoring mobility first, then they start introducing strength. Myth number 7, adjustments or passive treatments will fix it, will fix the back pain. If I just go to the chiropractor and get my back cracked, I'll be good. Or if I just get a nice massage or acupuncture, get those fancy needles, I'll be good. See, the thing is that hands-on treatments or even acupuncture, sure, they could give you temporary relief. I have nothing against going to these practitioners for temporary relief, but they're not oftentimes a permanent fix. See, 80% of people can learn to treat themselves with the right knowledge and exercises. Only 10% actually need hands-on care. See, relying on others just keeps you dependent, right? This mentality that I need someone else to fix me or save me, instead of giving you control so you can save yourself and help you teach your back. Obviously, if you don't know what you're doing, work with a professional, but they should also be teaching you exercises to help you regain control, because oftentimes the exercises, the active component of the treatment is what's going to ultimately get you better, not just relying on the temporary relief you get from the adjustment and then having to go to the chiro every week for adjustment. Instead, if you learn how to mobilize your spine with just simple back stretches, right? Oftentimes it's just back extension exercises. And obviously it could vary depending on the case. Oftentimes when you learn the right exercises, you could do this on your own, do the exercise at home or at work or wherever you're at. And you can manage the back pain on your own without having to rely on countless visits with the massage therapist or the acupuncturist. Myth number 8, a flare-up means you've re-injured yourself. My pain came back. I must have messed it up again. See, flare-ups are normal, especially during recovery, often triggered by stress, poor sleep, or sudden changes in activity, not a sign of new damage. Oftentimes I'll work with people, military vets who you don't understand, I got a pain flare-up, I must have done something. I'm like, okay, walk me through your day. And oftentimes it's the most benign, they're just like sitting 8 hours. They just sat, they didn't get up out of their chair. I'm like, dude, you're just sitting for 8 hours or 10 hours. That's most likely why your back hurts. You didn't necessarily cause catastrophic tissue damage, right? As long as you don't have, neurological signs and symptoms, leg drop, your leg is completely weak like a spaghetti noodle, numbness, tingling, or numbness or tingling in your saddle region, the groin region. If you don't have any of those issues, right, those severe neurologic progressive deficits or foot drop, oftentimes it's just benign back pain from sitting, and you just have to change the position or from standing too long. The other problem can happen if you maybe work a retail job, you're just standing all day now, so you're just standing still for 8 hours or 10 hours, and now your back locked up from standing still too long. Same problem as sitting too long, you just have to stretch it, right? So it's not a sign of new damage, you just need the right movement strategy, ergonomics, and flare-ups become less frequent and less intense. Oftentimes, you can just learn how to self-manage your back pain without having to freak out thinking you have to go to the emergency room every time you feel a back pain flare-up. Myth number 9, surgery and injections are the only real solutions. Nothing else worked, so I must need surgery. See, surgery should be a last resort and often doesn't solve the root cause. And unfortunately, 50% of people who get back surgery still have persistent pain. Because the truth is that it's not always about the tissue damage that they see on the MRI. So they may get, back surgery for like the disc or facet joint. They may even get for like a fusion for like spinal stenosis or something. But the thing is, Sure, it can work for some people, but for other cases, they can still have persistent pain because it's less to do about the tissue damage and more about hypersensitivity of the nervous system. See, most veterans' back pain actually responds better to education, knowledge is power, movement, and self-care, right movement. And this includes aerobic exercise. And it doesn't have to be running a marathon. Again, it can be as simple as walking 30 minutes. If 30 minutes is too much, again, you can start with 2 minutes and start building up from there. And then the mobility exercise and strengthening exercises in combination, right? And then, making sure you're sleeping enough and all these things. And even nutrition could also play a role as well, especially if you're overweight. So surgery should only be considered, after you've tried good quality physical therapy rehab, especially ideally someone who does the McKenzie method for back pain for 3 to 6 months before you just jump to surgery, and always get a second opinion to confirm. So hope you guys found this useful. And if you're struggling with pain, right, whether it's back pain or even knee pain or other types of orthopedic or sport related pains or injuries, join my 28-day Operation Pain Free Challenge. If you're ready to finally get pain relief, and for some people, it could be rapid. You could get rapid relief or at least an improvement in your pain in the 28 days. I'm calling it Operation Pain Free. You'll get 4 private one-to-one sessions with me, a custom program designed to get you pain free in just 28 days. Plus access to my free Skool community where other vets are sharing the wins and support. So just click the link in the description to join. And you can just send me a DM, just DM me the word Operation Pain Free or OPF that you're interested in this challenge here. And then if you liked what I'm sharing here, if this video helps you, or if you think it will help a veteran that you know, please share, like, and subscribe to my channel. It helps more veterans find the truth about pain. I talk about all sorts of injury, not just back pain, but I talk about knee pain, injuries related to running, lifting, etc. So start taking action to fix it. And you gave everything to the mission during your service. Now it's time to make your recovery the mission. So let's get you back to running, lifting, rucking, and living pain-free starting today.